দুয়া স্টুডেন্টস সকল হইয়ে হন্দলা কি পার্ট অকল রেসপিরেটরি সিস্টেম আমারে ইয়া ন্যাশো সিস্টেম আমারে আছে তই আতিকা সাজ আইলে आरा न्याशा सिस्टम होती है हम दिखते ना तुम्हारा ऐसे केंगुरी लेका से रहा नेजल कैविटी मानी नाकुत्तु शुरू होते बना सिर्फ आता रिदे न्याश होती बाय ऐसे बना सिर्फ न्याशा सिस्टम बना सीन हमारा आसे दे जीन हम लंग्स कल आसे ही बना बल्कि आरा इबा शुरू होते नेजल कैविटी तो नाकरिन तो शुरू हो बो ओके ओरल कैविटी मुकत्तियो शुरू हो बो pharynx आरा तो ऐसे टोरल्ला जन्नो आसे निसे टोरल्ला ही बालोई आरगो लैरिंग्स को आसे फेरिंग्स को आसे हिनरे खारेक टुरुल्ला हो हारो लैरिंग्स आयन कोइना पारी अमत्तो आनत्तु ट्रैकिया आसे ट्रैकिया अन जन्निन लंग्स हमारे बनाये रे एंगुरी एरे देखो ने तुम्हारा यमारे मुयरे तुम्हारा दहमारे this is the trachea and from this trachea इन कोला अने एरे मत्तो lungs आ इनरो होदे lungs कोला फेशा जन्नो होरी अने तो फेशा हिन हमारे main चीज एरे गुरी 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 इन गुरी गुरी यादल फादाना दल गुरी गुरी चीज़ कल बनिये रे लंग्स बनने दुआ हेतला त्वारा होने दिन फेश हाई होने गोरु फेश हाई ले मत्तर सोलर फेश होने फरम गोरु फेश हाई ले मत्तर सबले मत्तर काउं अजीब सा रबड़ दल लागे हुआ and these are alveoli अने हिन लोई alveoli boniye re amatto here buture bronchi class tin loi amatto bronchi buture zin gure class hin hode alveoli ane mucolytics bolu ho hin amare ki hode that the patient is having already a cough already having mucus lectua sputum is there but we need to make it the viscosity re reduce gori balla dorona taballa lecto asane sate nelizaballa lecto nelizaballa boli so we call it break desulfide bonds to reduce mucus viscosity that they are called mucolytes ane so common mucolytics are acetylcysteine, carbocysteine, erdostein. I'm sorry, as I've said, I have a German accent sometime because Arad dilaguru ho jatalla. So these are the common mucolytics. Toi ki goriba tu tuar babayo hodde ofut mottu de ere hashad dawa hamor mottu de lettonenita ke lekin letto jo doro bukune nina zagoi toi tu okay dad I the pharmacy mar jai akada dawai kini tu pharmacy boni dio doctor me tu da hamasa pharmacy zavruwa to here jatto tu jaiba doctor yare pharmacy sor hobade ke I need morogo mucolytic do hite ki goribo twaro gande dawai go hashad dawai go dibo dire then you will check if there anything in these cough syrup acetylcysteine is there carbocysteine is there or erdostein is there ane hi batakile to you would yes this is correct I think into hono chemically bamana tale you will say no sir give me another cough which consists as I've said my father is coughing he's coughing his viscosity of the sputum is not good so that's why please provide me a mucolytic okay or mucolytics okay so these are the common and then mechanism of the mucolytic hui argos the expectorants we have antitussives we have mucolytics we have expectorants which increase airway fluid secretion to help clearance it increases the airway fluid secretions to help the clearance yana matlab nakottu ok mukottu ok denna letto hoir nakashion hoin hinare nela fele de bokkune hinare sab kore de take ara tu breathing asan oballa para sirf hasnolo de nobo we also need to that the airways are clean right acha तो कॉमन एक्सपेक्टोरेंट्स हमारे क्या से गुआफेनेसिन, ammonium chloride, and salts. थोड़ा दिक्कत है तिक्के तिक्के कहनो these are the medications, but salt you are going to say no nunkalla erashe ane ogoide ammonium chloride or goide sodium chloride. They both they both are salts, but at the same time they are not used for the food only. They are also used for the medical relief. So you know ma ki kya se medical relief samare sodium chloride ma tona dikkade normal saline kal hi nannoni guri guri hodunoni ode ya kala se saline kala se zinnire nakamare manche drops odol istemal gore hinera alog guri dawai dol istemal gore ar tuar to te gorom mare saline ta kile hinera nakamma divare. It helps the patient to clean the airway path ane to ya nera hu tu bade ki tole doctor ambiara de tole sodium chloride saline hinera have a jum. You don't have to drink, you just have to, it's only locally used, but you can drink water which has also a little bit of salt, right? Ammonium, it's a very dangerous. There's a ammonium chloride majority मेरा जो ना देखो लेकिन खुदून दवाई कलम मारे खुदून nasal drops कलम मारे या nasal drops कलम मारे इतना ammonium chloride को इस्तेमाल कर दे ताकि नाक कल साफ हो जाए बल्ला और ammonium chloride mainly is also used people when they are unconscious खुदून मंशरों ने बियोशोगरी फरिदागोरे हना epileptic no honetto heart attack hoire hinla biush no zeninattu psychogenic mari ya psycho convulsions boli ho because of the mental disorder or because of the dissociative matlab flashbacks of jaye biush jago de hi bare hitarare ammonium chloride kol de fu wala take tara awake ko wala boli. Okay, so the clinical indications, these are chronic bronchitis, thick mucus conditions. Bujane ibamare aham mutarare zanna hum khoyam expectorants amare zin are different called drugs called zin ase hin kella istemal gore de dawai called chronic bronchitis amare de thick mucus conditions akal amare long term de talawa lekin there are also for short terms also we use that. In Germany or wherever I have practiced, we do use not only for the chronic but also for the acute bronchitis. Acute bronchitis हमारे फोला दिन इस्तेमाल फोला दवाई बदीना वारीबा. For example, I will go later how it works. Bronchitis. Now you are going to what is the bronchitis? What is the acute and chronic? All these things you will learn in the clinical sessions. So ओ या कि होता thick mucus मतलब लेट्वा आड़ा ही बा निमोनिया वजह तो इफ़ारी बो ही बा वायरल इन्फेक्शन वजह तो इफ़ारी बा फंगल इन्फेक्शन वजह तो इफ़ारी बा यही बा तो खाना chronic COPD आसे या lungs में कैंसर आसे वाना से याना से asthma से तरह तो लेट्वा ना लाइटी या फाइंड तो खास तो पर गुरा फाइंड तो लेट्वा आड़ा तो दे बुरा ना मैंने उंगली ना लाफली ना लेकिन for them this is very important that they get these kind of expectorants. So ne to hi namara arkada ki dekhi thick mucus wa acute the bronchitis hamare acute hamare de chronic hamare kalla istemal gori bhare acute mana bhare because when you are acute you have to relieve the lungs, not the nose only. The nose comes later. You have to because थोड़ा दिक्कत है ना मंचे इन्हें होते तो एड़े भाई न्यास तो फरे कल्ला मुकुट ने ला फरे वाना तो फरे एड़े problem है इधर टाइट हो इधर congestion is here. That's why we have to help them with the other medications, not the expectorants. But later, once he or she can breathe properly, like asasa national falle then you say, okay, my child is stable right now, then you put the nasal drops. Okay, contraindications and the cautions. Asthma exacerbation risk and hypersensitivity. Remember that I told you that when you are fighting with your lungs, when the asthma is exacerbating, getting worse, or having an acute problem, you cannot use that at that time. You can use later, but at that time it is not. Or hypersensitivity. As I've said, ammonia is a very dangerous. People, it's a very strong. خودنی ینا بدج گوری نفره خاص طور پر گرافنده بدج گوری نفره برامنچ بدج گوری نفره ار خودونو تو cystic fibrosis بولی فون نبلو میدگارامر زنیره تو retention of the sodium in their lungs and their skin sweat glands हमारे retention of the sodium मर हितरा मंचे ही नरला या इबा risk को थरे हतला not to give initially but later or for the cystic fibrosis not too much less. Okay, so I mean, what I'm just nausea hobo, vomiting hobo, rash hobo. Here, my bishiguri dilematar, yas, honunat to patajguri, na palamata, naka drop a call to a bishiguru, sodium chloride, ammonium dorivaiki, na amata vomiting with faribo, hoguri filiboka, lime book, hoguri filwoda. Are hodunatu, they can also develop rashes. Rashes means some of mare rashes are called lalot faribo, lalodwa mainly lalodwa. Okay, now we have a combination therapy. Okay, combination that we understand what is this combination. So what we do is that in the combination therapy, we have a mucolytic and bronchodilator. Bronchodilator or mucolytic. It is a combination therapy. It's a very interesting. So you will find later also other slides how we use it. So bronchodilator amare ara hoidene bronchial suckle, ovule suckle, bronchial suckle, ovule suckle hin kunni hede lecta bori ere baji giyo goi. Titara ki goji itara guri guri ho giyo goi. Zin fadana kol guri guri fadana se hede lecta baji giyo goi. Hede amat lecta thake de lecta is a foreign body. Of course, every organ has its own secretions, layers of secretions are there to protect. But lectohadiba infection of vajaya ashidetalla, yarogo honog disorder of vajaya ashidetalla, hitaria mara boriwa. तो बोयता के लिए मतलब इतना irritate करूँगा, है तो bronchioles अगर irritate कर ले मतलब inflammation कम नॉट है तलारा की गोजुम lectoasani साथे nebulizable ला बोली अने आप तो की गरा हुआ हाँ महान लेक्टोरे ते इंते आरा इंते या मुकुलेटिकल दी अने मुकुलेटिकल दी ले तो मनुष्य भाई it टाइट की तो नहीं लेना हमारे आना की गुजुम bronchodilator कल दियम इन लदा वाई गुजुम दे जन्ना ये bronchioles का आरा स्लीप इबा bronchola इबा ये कुली वाला कोशिश करी वो then lectoasani साथे नहीं वाला कोशिश करी वो अने तो अतिका हम तोरा हो बदे कि ब्रोंकोडायलेटर कला ब्रोंकोडायलेटर दे इलेक्ट्रोन आसान हो जाबे को आ तो मुकोलिटिक कला दे फरदे नो अतिका है ब्रोंकोडायलेटर दिले मतलब इबा कुली बदे यस बट म्यूकस मुटा दोवा दरो दोवा हिबा अतिका से नेली आइली हो हनकन जगह मरा फांसी जाइबो गई हतलारा की गुजुम दिनेवा हम गुरी बल्ला बु ताके फानी तुल नेली जाय बल्ला बोली इबे कुल्ले lectoya normal giye goy lectoya bishe ara nahi fanne hogi ke baneli jai bola so the therapy is better, right? Okay, good. Then we have an case example, adult with productive cough and thick sputum. So arattu ko hum bura manush ase ya adult ase jannatu productive bishiguri ya electronelate and but it's very thick. So what we do mucolytic da hama de furwo no sorry bronchodilator hama de furwo. This was the example twara to the electronelate manish me hasher twara to kala iba marononi ya mare ki hode mucolytic kala de furode kala aro asani sate nelizabella aro jaga kol mar inflammation no balla bolu dinwa de furu. So this is the example of mucolytic and what do you say bronchodilator, and that is a combination therapy. Okay, acha argo idike mucolytics vs expectorants matlab lectronelizable la boli lectonormal la boli ane argo inti nakutu di balla boli ठंडो या आरा एयरवे बेहतर बनी वाला बोली mechanism and clinical use. So mucolytics, I have already said earlier also, chemically break down mucus thin and sticky, mucus becomes less thick. Expectorants increases water content. Hetera, funny in zines, ara drop circle di tera, funny bishodetalla, etera, ara zin cell circle ase, zin organ circle ase hinnoni, kuliza go hitratu, asani sate ojo goa. Factor takile matto funny zate mushkilo bodononi, samana kolmetu ara kigurde funny dali, funny expectorants boide funny dole take smoothly bazai, fan make mucus easier to cough out. I hope you understand that. Okay, good. Now it comes an asthma pathophysiology. Ya tuara maro habadiki to respiratory drugs, it's very important, the ones that I have said earlier. But majority of the people still ara deshak kolamare matlab zede ajo dawa, you know, I cannot say it's uncivilized or low civilized. It is advance of ruwado. Civilized, it's like touching matla shunduru khatoina dani mention bazina dani. That is, you cannot say civilized. Matlab more definition in the ladwa. I feel like saying less advanced, you know. So less advanced countries are kalamare zindala khas taur par Bangladesh ase, Arab desh ase, Pakistan, India, and all those in Africa also, and even in Latin America, you know, even in Europe, there are some like Albania, Romania, they're also less advanced countries. So the advanced countries in Amare khas topa manushakol morizago de asthma loy. Find the call complications of the asthma loy. Acha. Kella ekte kya hoyi less advanced doctor sokol home ya doctor sokol takile they don't pay attention, they are so overloaded, they have so many patients, the patient does not understand them, the patient is uncompliant, so the doctor just want to sometimes get rid of him, you know. And even the doctor explains to him, we are very non-compliant people because we are not that much educated and our society is not that much advanced. But as I've said, asthma is a very, very critical. Tuara doctor nolio, paramedics olio, tuara pharmacists olio. Make sure even our public, normal public, tuara goram mara tuar futotununi chronic ya asthma ye ya asthma patient ase, how we treat. It's very important to help them, and your proper knowledge on asthma. Important, no. It is important, but this is a critical. If you can help a patient, a patient who's going through an asthma or who's been already diagnosed as an asthma patient but having an acute attacks, if you can help him, you have saved the humanity. They really struggle. Okay, so asthma pathophysiology is chronic airway inflammation, bronchospasm, and mucus hypersecretion. Okay, so it means our lungs, both the lungs, are having a chronic inflammation. Keloide, chronic ba, acute no. Because the constant bronchospasm, zenara alveoli, and the bronchus, they are all the time in spasm. In spasm, our head a hypersecretion. Kalla hypersecretion de. Because I'm breathing, and they have to open. They are not opening up. So what they do, opening up not that there is secretions or, and they are collecting and they are not opening. So the organ, the lungs, the bronchus, the alveoli are fighting so hard that there is a hypersecretion is there, and there is a chronic airway inflammation is there. Okay, so that is the pathophysiology. Chronic, because of the chronic inflammation, we have the bronchospasm, and there's a hyper secretions of the mucus. Okay, classification of the anti-asthmatic drugs. So how we classify drugs which are used against the asthma, right? And then we have one which rescue the asthma, and we have one which control. Ne? Toi drugs asthma drugs amare zenoi arare rescue koribo. Jata to taklif hobo attacks hobo, they will rescue us, and there is a one which control us for the whole period, right? Okay, good. So okay, so there is a beta-2 agonist, and the controller are steroids, leukotriene modifiers. So short-acting B2 agonists are SABA, okay. What are those? Salbutamol, Albuterol, rapid relief of bronchospasm. Anybody has any idea how it looks like? Honikapto idea asini ba hundla dawa ot paribo tora hundim punnone ba salbutamol albuterol zanine how it looks like. Anybody any idea? Have you ever seen this type of short acting B2 agonists?
Yes, salbutamol punni ara
okay.
hasguri
Okay.
Zara to niki asthma COPD ho itara manele ব্যবহার করে দিরি salbutamol.
Okay. তো হিতরা কি দাবাই দিয়ে তোমার হনে নিকো না?
Salbutamol de arol de montelukast.
Yes.
Arko doxycycline bronchodilator.
Yes. Okay. Good. So
salbutamol inhaler de.
Exactly. This is the one. Have you seen this?
Absolutely, it is used in by my father.
Okay. Okay. This is inhaler. Walaikum assalam. This is an inhaler, and many people, especially the respiratory, to asthma se, COPD se, COPD means a chronic obstructive pulmonary disorder or disease, and no ase taratu to dilabiara mase taratu as gar nishan problem ase, they all have this this thing, this inhaler. So even only usually it's a very difficult for the children to use. Again only ba gurafindere dito yaya ajju gurafindere Bangladesh ma de mudikam. How this child will use this inhaler? But this is ABC of the asthma patient. If he knows how to use it, he can really relieve from the asthma attack or acute bronchospasm attack.
যারা নাকি মানুষে ইনহেলার ব্যবহার করে ইতার আল্লাহ মানে হিবা সেপ নাকি জন্য ট্যাবলেট ব্যবহার করে ব্রঙ্কোডাইলেটর আছে অ্যান্টি অ্যাসমাটিক ড্রাগ আছে অন্য সেপ.
Okay, this one is safe. But yeah, you know why? Because this one is an acute. When the relief, that is a controller, but this is a rescuer. This rescues. So Gurafindallah, even on it, Gurafindallah, asli ba mutuhon, sorry, I don't know where my diagram is. Kibanoni in the lambagurine chamber dole. In iba batanoni, wal lambawa. To durut to dieri ba assess mukamare gole deri to find the tiba asanova. I don't have the, I think I have some
nebulizer.
Yes, like a nebulizer. But there is also one nebulizer na argo asadeki that nebulizer you can use also at home. Nebulizer de hama fani di de forwa. Normal saline of fati nebulizer gara forwa. Argo asade bana sirf iba pattano ni wal lamba ne lamba fisatto ade iba muntu mare denu uba fisatto mari bode lamba mikya, and the children are easier to breathe. But this one is still using. It's very common in non-advanced countries. But as I've said, this is the main thing for any asthmatic
patient. Is not available. This that one.
That was not available. I know that. Acha, argos dege long-acting B2 agonist, LABA, salmeterol, tonafunno. Formoterol maintenance therapy. It maintains the therapy. It is not used in the first acting. Argosde inhaled corticosteroids. तोरा दिक्कत हो नहीं माते के दिक्कत है हमारे दिक्कत prescription में दिक्कत doctor के लेके ICS लेके and then he will write down some medications. So it means it is inhaled corticosteroids. और खुदुन क्या कलम मारे steroids नाशिल इबम मारे steroids असे. And steroids has danger too. It weakens our bones, our muscles, our immunity. Hatalla steroids call istamal goriba shot. It's a very minimum dose call dewa. Doriba shot arat bishi careful tafru de ke it is used properly and it is not misused. If you often do that, your immunity will become weak, you will have fungal infection, your lungs will have fungal infection, your bones will break very easily in future, and so on. So inhale corticosteroids, these are the ones which we used for long term. It's not a rescuer, it's a controller. It is also at the same time long therapy. Okay, what are its function? This budesonide and fluticasone, anti-inflammatory, prevent exacerbations. Control for long term. Okay, and there are systematic corticosteroids. Those are inhaled. These are systematic, and that is used in prednisolone in severe acute attacks. Tara hunudin hospital mar hum gujna hodani ara hede. Atika patients akal aine ni. I cannot do that. You know, muzatum fan ere nebulizer diti. Ane fiber nebulizer diti. Oxygen diti. We have to the saturation. The oxygen saturation is going down 42, 41, 43. I have to say, what we do, we give them direct IV, prednisolone or corticosteroids, which will help everywhere. That's why it's called systemic corticosteroids. Argoside, just right now, one of our students said, Montelukast, you know, that is a loitrin modifiers which mediate inflammation. They are working like a mediator, you know, they just make sure that surface kala surface fan tigzafan gala surface oral cavity fan tigzafan the trachea fan tigzafan hindilandla they just work. So one of the very leukotriene famous one is the Montelukast. They often prescribe, or we often prescribe for our children. Okay, now we have theophylline and methylxanthines. These are the bronchodilator and also the phosphodiesterase inhibitions are innoni. And I cannot also tell you a lot about it. I'm not a pulmonologist, but they do use these things also as an medications in the acute this ones. Acha, argoside anti-cholinergics. What is this anti-cholinergics? These are the called anti is a German word, I'm sorry. Anti-muscarinics. These are the drugs which block the action of the acetylcholine and the muscarine receptors in the body. In the respiratory system, they relax. They relax the muscles and reduce mucus secretions, helping to open the airways. Acha, inoni anticholinergics noni sometimes we also use not only in the asthma patients but also to relax when the patients have epileptic attacks. Acha. Argo asade. There's another one called mast cell stabilizers. These are the chromoline sodium, which prevent mediator release. Mediator da ase hitarare often bishi release no guriballa, over function no guriballa, like a less function no guriballa boli. We also use some kind of mast cell stabilizers. Okay, now we go to biologic therapies. Biologic therapies, you're going to say, why do we need that? Actually, ibanoni anti hemoglobin E therapy in severe asthma is tamalgo, or but they are mainly used in the hospitals or the departments which are expert in dealing with COPDs, with the chronic asthma patients, with the cystic fibrosis, cystic fibrosis, and the ones who are on complications with the tuberculosis. Also patients or people who have professional asthmatic problems. Zanina, for example, gas la hamgore, chemical factory ma hamgore, hitaralaya in istamagore, and as I've said, it's a very, very expensive therapy. I'm not sure whether it's available in Bangladesh or not. Germany, Mario, very expensive, and then sometime, as I've said, it's only allowed for the people who are really with the cystic fibrosis and then the COPD. Okay. Ya aratu combination therapy guaishe. Hodum patient marim bukkun istamal gore de. Ane remember the IC CS, the corticosteroids therapy, long, short acting, long acting loy, short acting loy, in certain patients. Bukkun milai go gore, ugga milai go gore. So inhaled corticosteroids. So we have this, I have given a little bit examples over here, but we should be very, very much careful while giving these medications, because the patient can have collapse of his lungs and also collapse of his head, and also he can have collapse of his heart. Therefore, these medications should be very, very, though it sounds very interesting, very easy maybe, but it has long-term complications. But as I've said, especially the patients who are, or the children who are having a chronic problems and they cannot live only on the rescuers, they need for the long-term this. Acha. तो दवाई दे आ रही इन दी तो हमारा हुन दिन दिक्कत glucose and salbutamol di. I don't know whether you have went through or not. Let me just share with you one scenario. I 22 years हमारे I October नहीं गिर गई, and from the 22 years of my age, even becoming before 22 years of my age, I became already a doctor. तो ये आरत तो है इन्होंने patient circle दिए है, and I don't know, fortunately, unfortunately, fortunately, तोरे मोरे ER मार दियो तो ER मार दीदे है गो बुरा मानुष गो आशे बुरा मानुष गो इधर बाइशे दे, and इन्होंने बर्मा मारे no outside, तो बुरा मानुष गो आशे, it was in Russia, and the patient was heavy smoker, heavy smoker, and she used a lot of hairspray for her hair. Old lady, I think she was around 68, very strong perfume, and she was also working in a factory, chemical factory. She was breathing and breathing. So, student man for Julum doa, hadala muki gajam, yeah, kesuna goriba agotu. I just went there and I started to grab the medication, this salbutamol, and I started to spray. Hibara hamadde ki tu age bas tamar gojilam nahi be hode yes tamar gojilam mu hode motto effect no de mu hode tu no dana de falla tu gorina dana de nole gavra, and she was doing, still she was breathing and breathing. It was very difficult, and to matara monitor rakhi de she was above 180 tachycardic. And I cannot do anything, even I cannot put that. So, of course, my consultant came and he said, move away. What did you do? I said, she just came. We were explaining the job. Gori bada matata rakhi goji bara IV line lagaiye, oxygen diye, and then her tachycardia was still increasing and she was also shivering, tremor. They took the blood and all those. Then I was just wondering, I did the right thing because I gave the salbutamol because she was not breathing well and all those. So the ABCs are very important, not the medications. You have to put the patient in the monitor in such patients. Then you have to check with the asthma attacks okay? No matter what, you have to put them, the patients, on the monitor, and the oxygen is very important. Okay? So saturation blood pressure, heart rate, this will be done. This is needed. But for the asthmatic who comes with the acute asthma attacks or respiratory distress syndrome or symptoms, you have to check their saturation, O2, oxygen saturation, right? Then you do the other things. Then you monitor, of course, you put them the IV line by the nebulizer diba de zinzing gorafru. Okay. So hypokalemia is also a death symptom because our heart need a proper, kalemia means potassium, to function. And if it is low, then our heart will collapse and we will lose the patient. The patient can go to coma or we are going to lose the patient with a tachycardia, bradycardia. Acha. Hypokalemia, salbutamol, excessive. Bishi cheez kal khana restricted ho jago arade wangkhai yangkhai zare potassium kalasa ane hitara ham khade talla gurafandalla talla. This is very dangerous. That's why when you do the sprays, the nebula sprays, you should be very, very careful how you give. And the proper one, I'm going to go to my next slide, is the we have to use it properly. Acha, ariya babadaro kya se steroids kata hoy dinoni kala steroids may ba inhaler tarafatta itfari ba hiba dawailo itfari ba zana oral thrush, as I've said, oral thrush, growth suppression. Gurafan hodun pa dikone hodun to fatam ko pat danu biara me kala age to mar fatu kyo do ar fa noni nyasha biara me de. Because excessive of the steroids, there is a suppression of the growth and the adrenal suppression. जिसकी वजह से आपको जो है ना क्या बोलते हैं sorry आपको you have to be careful with the steroids. Good. Then how do you monitor asthma spray ko lor dawai ko lor doctor lekhi dile lor fur agile nozor ane amatode ki dawai doctor di debe mara no dekhe eba gam doctor no, this is completely wrong. You did not have the proper treatment, you did not have a twar compliance ar bajaye tu nole doctor galat guri bujaiye nole tu shundo no buzo nole tu shundo guri no lo. So asthmatic patients has to have to find it out. Hibar biaram hotte bishoye ida peak flow kal mutwara hondam spirometric was a symptom diary. Is it in the summer? Is it in the winter? Is it in the dust place? Is it with the smoking place and all those stuff? So it is very important so that the doctor find it out when your symptoms increases. Han season amare, han time amare, asthma to itfari bode to attacks itfari bode talla. It's always important. Para de mashallah, our students call futane call. Para de smart. Para fanawalogi alhamdulillah alhamdulillah. Bana sirif sanguri zano dona active panana hore para to para bamala dawai kini faro taralla post leke fara doctor of matik communication guri fara. Alhamdulillah, alhamdulillah. It's a blessing for all of us. Toi mamare atika toa mama mala toa nanila toa dadila atika toara inguri di file, you know, to write it down, to note down to doctor zero over mor matununi shitamare bishio yara zaga mare bishi dust ne to hindalandla guri guri bate. Okay, so this is a peak flow. It is, as I've said, in Bukula available now. Our hospital, हमारे पास सिर्फ ज्ञानवा respiratory patients को ले handle करे pulmonology department बुली हो या pulmo department बुली हो हितरा तो इन आसरे to see एरे तो आं दिक्कत बे peak flow मरे है दहा जब उधर तो आं एरे एरे तुम्हारा फूमारी बने मतलब गोरी बने तो then the machine will show you how good you're breathing and how much you need to inhale and exhale. Acha. So as I've said earlier also, the patient education inhaler technique is very, very important. It's like praying. The Nara Kormafuri, Tuara Salbutamol, I think a honikara prescribe gole, Kinyani de Lekiani dile, Kamala Kinyani dile, to harm had techniques and a technique de okay, to trigger the avoidance. Okay, now we have a someone 12-year-old with frequent nighttime asthma symptoms. How do we deal this patient?
We will give
We can
salbutamol
give
within
salbutamol
Okay, salbutamol and
inhaler and bronchodilator.
okay. 12-year-old with frequent nighttime asthma symptoms. Okay, now all the things that you said is excellent. But this child is at night. तुम्हारा दे है तो नम्मा उड़ी रे तुम्हारा दवाई दीबा यार अगर तू की गरावरू we have to find out why night. What is there that the patient kala asthma symptoms 12-year-old frequent nighttime symptoms she's an asthma patient. What we need to do but to dawa dena taibo he tu raktama ki gujumara. It's important that you put the patient in a comfort, stable position. The ones who are asthmatic, when they lie, they have a very breathing problem. So what you do, you put them in the semi lying down positions and you make them understand that everything is going to be fine. And if you have an asthma salbutamol, you give them 2 puffs. But as I've said, the technique is very important. Master Save, I would like to explain in future, especially how to take the inhaler. It's very important, and that can be done also on online. We don't have to physically meet. Toy you have to see dust and you have to take the patient to next day to the doctor. And as you are right correctly, but this patient needs to be seen by the specialist.
I have a question on that. That is, if asthma is induced at night time, what I will do?
क्या बोले आप? Sorry, what did you say?
I had a question on that. If 12 years old induced asthma at night time, what I will do?
If it is not on night time,
if I don't know about that, if I don't have the medicine of asthma.
Okay, if you don't have the medicine, that's why.
How can control that?
What I will do? Yeah, how can I control that? I want to clear it. Yeah.
Okay, I got it. What's your name?
Muhammad Noor. Yeah.
Muhammad Noor. Okay. Acha. Noor, you know what you need is that you don't have the medications. What you need is that you have to from the lying down, you have to put the patient in the semi-lying down. Matlab, mura inla nedatno, balke addak dikane inla nedamat, so that the patient will have easy to breathe. Or you ask the patient, what is the best way for you? You can breathe better. Tiba ye boy mara no auntie uncle matune boyre gam laga. To boyre mada semi position is always good, but some people also like or they prefer to sit because they are scared. So you have to calm them down also that everything is going to be fine. Okay? And then if you don't have that this one, you have to take to the doctor as soon as possible. But
Thank you.
I taught the dinat nor. So therefore, you don't have to take that time to the doctor. You take next day to the doctor. Lekin asthma symptoms hamare, it can be like then this is the one where you have to take to the doctor. That is emergency. But asthma symptoms made. Okay, so there's a trigger. There's something at home which is triggering her. So next day you take to the doctor. Do not forget to take the doctor the medications, family history and the history of the illness. Our camp mare camp na balke Bangladesh. Atka Saz Isle, it's a very, 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 very dusty area. Allah ye twarattu imtahan ek lahasa lo duna bihar lahasa twarattu lo. I do I don't know lekin I misatano hoyum I don't wear the mask because if you have to die we will die together. I mean I have a different scenarios of all those stuff. To mask no phenomene, but it's very, very, very oh my god. Bishi dusty hatalla balu talu sanaha twara hoverna sanaha di deno niba sanahati bishi blockage okol asthma patients are in dangerous de kalla ara sanaha dile sorry ede maridi ede di ar fandere ede twalama di isanaha guri zina se in sukaza sukattu nakat guriza galaza and then their breathing will problem. I myself I don't allow people mara hone ke agana husha aledum mui strictly managoridum sana hano diwala. This is yamare kisa diere adha ganda badisho egidone fura velona du velona yanare kella raga dishara dimbar tanaka. This is a pollutant a dust which is unhealthy for any especially for the asthma. Acha. Now, mechanism, adverse effects, we have talked. The flow diagram I have shown you. See, rescue VS controller therapy decision tree. When I spoke about the 12-year-old child and plus Muhammad Nuru Fuzallah ki garawru, this is a diagram. Twara falle ki hodi bare save guru rakyo. You can also even print it out. Sorry, you know, as I've said, mar bafara to amatu tala bolum photo re gya phone re gya guru rakyam doa. Ibare print out goriyere thora no niba gya guri fariba asthma symptoms ki gora for rescue. Yes, ane tiba mare in ki gora guru de in a call iba thora print out good jona. Okay, then we go to what has happened. My this one quiz slides from clinical scenario to descriptions. Okay, I think I don't need this one. Acha argua se de antibiotics. There are antibiotics which we need to use and also in respiratory system. So mainly common bichidila antibiotics ase bichidila pathogens ase, but there are some common pathogens या फुकोकल जन्ने respiratory system अरे बिशे मोहब्बत करे. They cannot live without them. You know, that is streptococcus, pneumonia, and influenza, and also pneumonia M and the viruses and all those stuff. Okay, so these are the common pathogens of the respiratory systems. And what we often use are there are different kinds of antibiotics. There are broad spectrums and short spectrums, long, short, and these mono and also bi and plus all those. So penicillins and cephalosporins are the ones that we often use in the respiratory ones. And one of them, the very most common that we use for the acute ones are the amoxicillin and the cefuroxime. That means it synthesis the inhibitors. Then we have macrolides, we have tetracyclines. So these are different kinds of antibiotics which we used. These are another different types of another antibiotics. And we have to be very, very careful when we use antibiotics. मुदिक्कम दे आरा दशमारे आरा बांग्लादेशमारे दिक्कम देरी very common. हर चीज़ अल्लाह vitamin लेकिबो, iron लेकिबो, antibiotics लेकिबो, paracetamol लेकिबो, panadol लेकिबो. हर patient अल्लाह मोरी अल्लाह या इन दिबो, pregnant woman अल्लाह या दिबो, asthma अल्लाह या दिबो, and this. But you know, every medication has side effects. Paracetamol आरा kidney खराब करी फुलिबो, आरा liver has तो खराब करी फुलिबो. Zin painkiller class Hindella antibiotics and wase. It creates a lot of problems. Resistance. If you have a resistance towards the military, towards the injustice, it's good. But if you develop towards the antibiotics, you will not be able to fight any antibiotics, any viral or any fungal or any bacterial infection in future. Therefore, please avoid unnecessary antibiotics, prescribing and also taking and recommending also. अच्छा, antibiotics तो क्यों? वरना खुन्ने ना होता नहीं. هذا مرة هذا عثمان مرة هذا دكتور دواء وقد يا هذا خير مو هذا بنا صرف بارز هذا مدة هذا فاني دل زاد ها أربعة كي هو هذا متو هذا غامر هذا دواء کو دكتور حلق كدي هذا نه غامر هذا فولي كده هو سايا هذا نه تازنه كي هو مرة کو دكتور كي دواء ديلو هذا نه بخير منوني نياش لنا فرامر. Okay, so these are GI upsets and nausea, मतलब खागरत साइज़िबा, nausea, diarrhea. These are still okay. Allergic, for example, samakol fuliza goy gya. These are also very, but if they can also give you an asthma attacks or breathing problems, that is danger. That is really danger, and those are majority because of the fluoroquinolones. Okay, so pediatric, this is a very, very important topic. Should we make a little bit break or you want to continue? I have like 15 slides more.
I think it will take a long time, so it's gonna be good to break it 10 times.
Should we,
I mean,
should
2
we make
minutes
a
or
5-10 minutes? Should we make a 5-10 minutes break? Like then I can go with the pediatric one, or do you want to go continue?
Yes, we can.
Okay, tola ana break loine. Okay, then we come back after 5 minutes, 10 minutes.
After 5 minutes, it will be better.
Bukulla bishi problem ho jabe no, deri ho jabe no.
Filtration no asib amma khotun how many times we need?
Okay, we need like 15 minutes maximum more.
That's more.
Okay, 10 minutes. Should I make 10 minutes?
If we need that 15 minutes, we can continue. Yeah, if we need that 15 minutes, we can continue.
Okay, I do it 5 minutes. I do try to do it. Okay, good. Pediatric means in Germany it is like below 21 age is a pediatric. So I see patients sometimes also with the age of 21. I see patients with the age of 18 also. Ne? तो हितलाई in la khas तौर पर pediatric means with children who are below 14 khas तौर पर we have to see their weight when we give the medications. We have to see them profiles. We have to see their age. Do they have any chronic problems and those stuff. So 5-year-old with a community acquired pneumonia, appropriate antibiotic choice, we will go for amoxicillin. Then we have combination therapy. Severe infections may need 2 antibiotics. Okay. So vancomycin, meropenem. Sometimes they need to attack the pathogens or the infection. Summary table. Pediatric safety, class is very important, spectrum is very important, which spectrum you are using, mechanism is very used, and the main thing, as I've said, pediatric safety, you have to see this is a child, we cannot make him resistant, we cannot make him more sick, he has a long life, so we have to give him the proper treatment by knowing his age and the history and the weight. Okay, so again, age, weight, metabolism, that I have already said. Safe antitussives in children, this is very, very important. Children under honey, under 1 year, avoid codeine. Give them dextromethorphan and honey, but do not give them codeine. Then we have pediatric mucolytes, those in the Arabukunhoi, nebulizer, you were right. Pediatric asthma control mare, ICS preferred, monitor growth and adherence. And this is another one, once daily, mild asthma, Monte Lucas. Inhaler mare, finder mare, hone divo, kengri divo, space use ba kenge space use hode ba deba space ho hodwa ibare. Zanna thorara guragwa si bade inhaler agwa se space hiba gura findala stama gurde under 5 years. Ne tahitar Allah caregiver. अच्छा तो nebulizing ही हमारे की देवरुवो dose मुताबिक की देवरुवो केंगुरु देवरुवो and then the antibiotics, the correct doses are very important. So Atika Twana File, I'm not sure, maybe I can bring when I come 1 or 2 gifts that pediatric table ase antibiotics or doses of color. So if I manage to bring, I will bring it for you. Okay, now 3-year-old wheezing management plan, asthma, 7-year-old chronic cough differential therapy, chronic cough COPD, cystic fibrosis. So तुम्हारा रोग मुगत ट्रिगत बना दियम दे ICS दिवने साबा दिवने क्या होते लामा दिवहीन क्या कलवा then the adverse effects monitoring, watch for growth suppression, GI upset and hypersensitivity, chart and flow diagrams, pediatric asthma, stepwise management flow. Okay, so it's very important, safe drug choices, dosing and the inhaler technique. Iba gura messenger we have to see that we collect the safe drug. The doses are very important, and if you are prescribing for anything inhaler, the technique is very important. So for the drug class, pediatric use is very, very, we should be very cautious when we give and can be treated. Acha, even alibo. Quiz 3, this I will not go. Okay, that I have said. Now, done. Now I am done.
Thank you.
Acha, mumit goroma twara kesu bujjo. It's very tough.
Shukriya onarare shomodio diyan.
We have completely understood. It really gains some knowledge of you.
That's good. Alhamdulillah. So we will be very careful when we prescribe medications, especially asthma is if we want to become a professional or we want to help people, asthma technique, inhalers technique is very, very important. तो तुम्हारा ख्याल रखो इंशाल्लाह till the next time. Assalamu alaikum.
Thank you. Assalamu alaikum.
Welcome. Allah Hafiz. ख्याल रखो, दुआ हमारे याद रखो, मुझे तुम्हारा अल्लाह हमेशा दुआ हमारे याद रखो, राखिमा. Allah Hafiz. Allah Hafiz.
Yes.